Ms. Grace Marie, I just thought to myself just now, you were one that started this health care policy think tank really way before Obamacare. And I'm thinking, how good is it of God to have helped you and let you persevere, because now all that information, and it's so good that we've got you because of your knowledge from the very beginning. You're just now a spokesperson nationwide for the truth about really the problems with this Obamacare. And I'm so glad that you came today, because from what I'm understanding, October is going to be some major changes, so much pressure on getting the Medicaid exchanges. If someone comes to you and says, invest $1 billion, $771 million in Alabama, supposedly is the number, and gives you $15 billion back, that's a great deal. Somebody said, I will take that deal all day long. Alabama takes nothing for $1.5 billion in each of 2014, 2015, and 2016. It is not until 2020 that Alabama pays its 10% share. This investment will generate over $1.7 billion in tax revenues, create tens of thousands of jobs, and help over 300,000 women and children in need. So that's just one example of what is being pushed out there to little people like us that doesn't really know very much. So I'd like to ask you, in contrast, what would you say when you're giving that speech?
Actually, we have a paper. Thank you, Ms. Diane. It's so nice to be with you. And hello, Dawn. Nice to talk with you. The question over whether or not states are going to expand their Medicaid programs is really a crucial one, and one of the really important fronts in the fight against Obamacare. The law, when it was initially written, said that states had no choice. They had to expand their Medicaid programs. Medicaid is a joint federal-state program designed to pay for health care for the poor. They had to expand that to people making about 138% of poverty, which is a family of four making $30,000 a year. That's what those numbers mean. So this is really starting to push a program designed for the poor into those into the middle class, and this is only the beginning. And there has been an enormous effort around the country for states to do this. When the Supreme Court issued its decision last summer, it rewrote the law and said, basically, we're going to make this optional, because it would not be constitutional for the federal government to tell the states they absolutely had to expand Medicaid or lose all of their Medicaid funding. That would be a violation of the 10th Amendment. So the Supreme Court basically rewrote the law and said, all right, well, we're going to make Medicaid expansion optional. And so what's happened is all of the people who believe that they will gain from having more Americans on this joint federal-state government program are out lobbying for it, particularly hospitals, because they see, millions, hundreds of millions of dollars in new revenue coming in. But a lot of hospitals are having second thoughts, because when you see, yes, you have new revenue coming in to cover people who are uninsured now, the problem is you're going to have to provide care for them. And in almost every state, Medicaid pays hospitals less than the cost of providing the care. So they may have more money coming in the door, but even more is going to be going out. So it's a bad deal for the states. The Republican Governors Association did an analysis that showed that this supposedly free benefit from the federal government, where the federal government would pay all of the costs for the first 3 years of this Medicaid expansion, that free benefit will cost the states $118 billion between now and 20 and 21. So this is a big cost, because states are on the hook for all the administrative costs, and starting in 2016, they do have to start paying a portion of that Medicaid expansion. In addition, they're going to have a lot more people signing up for Medicaid who are not now enrolled because the Obamacare mandate takes effect in January, in which everybody has to have health coverage or pay a fine, or, as the Supreme Court said, a tax. So there are a lot of reasons that states shouldn't do this. Also, this is a jobs killer. This is basically saying that the government knows how to spend money better than the American people do. I quote, I have a paper on our website at Galen.org all about this and why the Medicaid expansion is such a bad idea. I'm actually going to be on Fox and Friends on Wednesday morning talking about this in the 7 o'clock Eastern hour. But the costs that states have to pay, the terrible quality of care that people on Medicaid get today is really abysmal. We should not be expanding this program. We should be reforming it. The great majority of people on Medicaid have a great deal of difficulty finding access to a specialist because, once again, Medicaid pays doctors and hospitals so little that they can barely afford to cover their costs. And so you're going to now wind up with as many as 90 million Americans on this program that is really, in my opinion, I served on a Medicaid commission under President Bush and studied this inside out. It's the worst health care program in the country, and they want to put tens of millions of more people on this program. The people who are putting out all these press releases are the ones who want the dollars flowing into their door, not caring about the violation of dignity of the people on this program that wind up having to wait in a hospital emergency room lines for 6, 7, 8 hours or longer just to see a regular physician because they can't get a private physician to see them because Medicaid pays so little and doctors have to jump through so much bureaucracy. And then finally, Diana, I quoted in this paper I mentioned on our website at Galen.org, a paper by Chris Conover, who's an economist who works at Duke University. And he says that for every dollar that the federal government, for every $1.44 that the federal government spends on tax money and borrowed money, we lose a dollar in the private sector. So this is not equal. And you wind up sucking resources out of the private sector and not putting them into the public sector and putting them into the public sector instead of into the private economy. And that's why we talk about ways to give people the choice of insurance that they want, private insurance that's portable that they choose, and not this government-run monstrosity, both of Obamacare and this expansion of Medicaid, which is basically putting tens of millions more people on a program that was designed for the poor. It is going to shred the safety net, and it's going to wind up making it more difficult, even more difficult than today, for people on Medicaid now to get the care they need because they're going to be competing with so many more people. This is not a solution. People on right, left, and center who study this from a policy perspective said that we have to change Medicaid, not just expand it.
It already knows it has a doctor shortage, and this thing hasn't even been unleashed yet. So much so that my state has passed laws that say, or at least we're trying to, don't know if the governor will sign these yet, but they're actually going to consider non-medical personnel as, quote-unquote, primary care providers now because they know they have a doctor shortage. So even if you manage to get in somewhere to see a physician, doesn't mean you're actually going to be seeing a physician. You could be seeing an MA or a nurse practitioner or, no matter how we look at this, how they've tried to squeeze this round peg into the square hole, what ends up at the end of the day is the most vulnerable will suffer. Wasn't the whole great selling job for this whole monstrosity was that, we have to provide this so everybody has the ability. Well, guess what? The most vulnerable will not have the ability to get health care.
That's exactly right. And that is really one of the things. There was a really important quote, an article actually in the Wall Street Journal while Obamacare was being debated in late 2009, early 2010, by the then chief of medicine for Johns Hopkins University. And he said, we are doing everything we can to take care of the Medicaid patients we have today. If we have millions more people, we simply can't handle it. We don't have the resources. We don't have the personnel. If we were to do this more gradually, we could build to a system in which we could take care of more people. But if you put this many people onto our system right now, he says it's absolutely going to collapse the system. And I'm worried that at the same time, we see hundreds of thousands, possibly, doctors seriously thinking about leaving the practice of medicine because they don't want to practice under such a bureaucratic regime in which they're being told how to practice medicine. And they see the handwriting is on the wall. It's only beginning. I think that we have to start moving toward all of our efforts being focused on at least delaying for a year implementation of this law. It gives us more time for people to understand more about it. You then will have it be an issue in the 2014 elections, which is what it needs to be. But right now, if those subsidies start to flow, it's going to be so much more difficult to stop it and to do the right thing to fix this so that we're not just expanding broken programs, but we're really getting down to the business of figuring out what is wrong with our health sector. We know that there are problems, but let's do this the right way, and let's begin a plan to amend this law or hopefully repeal it in 2016 before it can do any more damage.